What is the connection between Parkinson's rigidity and freezing of gait? Imagine your muscles feeling stiff and unyielding, making even simple movements feel like pushing through thick syrup. That's what rigidity in Parkinson's disease feels like. It's a common symptom where muscles become resistant to passive movement, causing stiffness that can affect the neck, arms, legs, and trunk. Now, picture suddenly feeling as if your feet are glued to the floor, unable to move forward despite your desire to walk. That's freezing of gait, a frustrating symptom where walking suddenly stops or becomes very difficult. These two symptoms are closely linked in Parkinson's disease, and research shows they often happen together and influence each other. Studies have found that when rigidity gets worse, freezing episodes tend to become more frequent or severe. This means that as muscle stiffness increases, it can make initiating or continuing walking harder, especially in older patients who tend to have more rigidity. Rigidity affects how smoothly your muscles work, making movements stiff and less coordinated. When this stiffness impacts your gait, it can cause trouble starting to walk or turning around, which are common triggers for freezing episodes. Think of it like trying to move a stiff robot arm. If the joints are resistant, it's harder to make fluid movements. Both rigidity and freezing are linked to problems in brain circuits that control movement, especially in an area called the basal ganglia. When these circuits don't work properly, they disrupt how the brain plans and initiates movement. This dysfunction affects muscle tone, leading to rigidity, and also causes the brain to sometimes fail at starting or maintaining walking, resulting in freezing. Interestingly, areas involved in thinking and planning movements also seem to overlap, which explains why freezing can happen alongside other motor issues. Managing rigidity with medications like dopamine-based therapies and physical therapy can sometimes help reduce freezing episodes. However, freezing can still happen even when rigidity improves, showing that it involves more complex brain mechanisms. Treatment often combines medication, cueing techniques, and balance exercises to help improve mobility and reduce falls. The impact of these symptoms on daily life can be significant. Rigidity and freezing make walking difficult, increase the risk of falling, and can lower quality of life. Freezing often occurs during activities like starting to walk, turning, or navigating narrow spaces, all situations where rigidity can make movement even more challenging. In summary, Parkinson's rigidity and freezing of gait are interconnected symptoms caused by overlapping brain dysfunctions that impair motor control. Rigidity can make movement stiff and contribute to freezing episodes, and both tend to worsen as the disease progresses. Understanding this connection helps healthcare providers develop better strategies to improve mobility and safety for people living with Parkinson's disease. Always remember, individual experiences vary, so it's important to work with your healthcare team to find the best approach for your specific needs.